Hello, and welcome to the EVA System webinar, where we will talk about how machine learning can be used to save lives, and specifically, women who could potentially die from cervical cancer. In the next few minutes, we'll cover everything you need to know about the dataset that has been collected from around the world using the EVA, Enhanced Visual Assessment System, and cervical cancer. My name is Alon, and I'm the Director of Training and Education at MobileODT.
And I'm Yao, the Product Engineer at MobileODT.
We'd like to thank Professor Albert Zinger, who has not only assisted in the creation of this presentation, but played a key role in advancing the field of cervical cancer screenings around the world, and recently has been working hard on preparing the dataset which you will be working with. So, what are we going to talk about today? We'll start with why cervical cancer. Because for a lot of us, that isn't the first thing that you think about as major threat to human health. But you will be surprised at how widespread this cancer is in many parts around the world. Then, we'll talk about the ways machine learning can help, specifically when using images. And we'll close with information about the dataset which you will use to try and save as many lives as fast as possible. So, without further ado, let's get started. MobileODT stands for Optical Detection Technologies, and our goal as a company is to provide access to care to low-resource settings. That can be either geographical or clinical. We started in cervical cancer, which is a major cause of death for women in low-resource settings, both in the United States and abroad. In fact, it is the leading cause of death for women in many areas around the world. To that end, we developed the Enhanced Visual Assessment System, a portable, smart, easy-to-use, and affordable tool for enhanced visual examinations. The EVA system is currently used in more than 23 countries around the world, and we have so far screened over 13,000 patients. In order to be able to understand the images that you will be looking at, we need to take a step back and take a few minutes to talk about cervical cancer. The cervix is the lowermost part of the uterus, and you can find it at the end of the vaginal canal. It's what connects between the uterus and the vaginal tunnel. The cervix is shaped like a small donut with a tiny hole in the center. The position and the texture change throughout the women's life cycle. And the cohort of women that are most susceptible to developing cervical cancer are sexually active women between the ages of 20 to 50. But more on that soon. We visualize the cervix using a tool called a speculum, which is inserted into the vaginal canal. Then, the health provider looks at the cervix and can provide a potential diagnosis. Cervical cancer, like oral and anal cancer, is caused by a virus, human papillomavirus, or HPV. In fact, more than 90% of the general population has this virus. But don't worry, this doesn't mean you'll catch cervical cancer. HPV-based cancers develop slowly and are induced by environmental, biological, and emotional causes. Cervical cancer takes usually between 10 to 20 years to develop. In those years, it is what you call a precancerous stage. And that stage can be treated for less than $30. Do you realize that one of the major killers of women on Earth can be caught and treated for less than $30? The problem is that often health providers don't have the proper tools to provide a diagnosis and treatment. So that's where the EVA system comes in. So, how does one screen for cervical cancer? There are two steps. The first is a primary screening, done by a nurse or a doctor. They either do something called a pap smear, which means they take cell samples from the woman to a lab. They can also take a viral DNA test to test for HPV strings. Or they perform a visual inspection with the naked eye. In general, the visual inspection is performed where there aren't enough resources for the pap smear, the lab exams, the DNA testing, etc. If a visual examination is performed, then an image of the cervix can be captured using the EVA system. Since we are focused today on the visual examination and the images captured during such an examination, let's understand how the visual examination is done. All you need is regular vinegar, a speculum, and some knowledge in cervical anatomy. The health provider inserts the speculum, applies the acetic acid, and waits a couple of minutes. Then, they look to see if there are any white spots. If there are, that's a good indicator that there is a precancerous lesion that can be treated and removed on the spot. The ability to recognize these lesions really depends on the skills of the health provider and the training that they received. That means that the accuracy of this examination is extremely variable, and the more we could help in making this examination more structured and codified, the better. Here is an example of how a cervix looks before and after the application of acetic acid. You can notice how the lesions have turned white after applying the acetic acid. Now you know how to perform the examination, but how can you tell if what you're seeing is eligible for treatment? It's time to understand the cervix type.
Before we can explain what is a cervix type, we need to get to know some basic cervix anatomy. Squamous epithelium is a common type of cells that usually occupy the ectocervical region, which is the outer part of the cervix. In the image, it is the outer, light pink region. Columnar epithelium is a different type of cells that normally occupy the endocervix, the inner part of the cervix. In the image, this is the dark pink region at the center. These cells are not fully differentiated. Throughout a woman's lifespan, some of the columnar cells transform to become squamous cells. The area on which this transformation occurs is called the transformation zone. The place where the transformation zone meets homogeneous squamous or columnar cells is called the SCJ, the squamo-columnar junction. The new SCJ is where the transformation zone meets squamous cells, and the original SCJ is where it meets columnar cells. So to summarize, there are two important regions we need to remember, the SCJ and the transformation zone. Now, before we move on to the official definition of cervix type, let's point out two more anatomical terms. Endocervical, which means inside the cervical canal, and ectocervical, which means outside of the cervical canal. And here is the official definition. The differences between the different types are the transformation zone location and its visibility. As we can see, cervix type 3 is the only one which is not fully visible. Now let's go over the different types in more detail. In cervix type 1, the transformation zone is completely ectocervical and completely visible. That means that both SCJs are ectocervical and visible. Here is an example for cervix type 1. Notice that the new SCJ, which is the solid line, is much easier to detect. In cervix type 2, the transformation zone has an endocervical part, but it's still fully visible. In this example, you can see that some parts of the new SCJ are located inside the cervical canal, but are fully visible. In this image, you can also see a precancerous lesion, which is painted white due to acetowhitening. Cervix type 3 is the most dangerous one. In this type, part of the transformation zone is not visible, so precancerous lesions might hide and therefore not be treated. In this type 3 example, an early cancer is hiding in the endocervical part of the transformation zone. It can only be detected if the care provider identifies it is a type 3 and performs an endocervical procedure. So why is it that cervix type classification is so important? Well, since most cancerous lesions evolve in the transformation zone, knowing if part of the transformation zone is hidden is critical. And like acetowhitening, detecting cervix type is highly dependent on the care provider experience. Automating this process has a tremendous importance. Now let's understand the dataset that you received. The thousands of images that are available for this challenge were taken over the past 3 years in 21 countries, mostly East Africa and Mexico. The images in the dataset are from real patient cases. Usually, more than one image is captured in each case. We took the best image from each session and gave it to an expert physician for review. These high-quality images are in the main train and test sets. The additional images taken in this session were annotated with the same label and they are in the additional images folder. The additional images are of the same patients, but have different properties like angle, filters, zoom, and also different quality. Some properties are fixed for all of the images. The white balance is fixed, and the same light source was used in most images. Other parameters vary between images. The working distance, focus, zoom, and image size all can have different values. In some of the images, a green filter is applied. Green filter is used to highlight blood vessels, which appear black when it's on. Usually, the screening process involves the application of acetic acid, which paints abnormal cells white. Another test, which is also in use, is called Lugel's iodine, and involves applying iodine on the cervix. Abnormal cells appear white, while normal cells are painted dark. Here, we can see a normal cervix. In some cases, the cervix displays different cervix types in the posterior and anterior regions. The overall cervix type is defined always by the highest cervix type displayed. To summarize, today we saw how important it is to correctly classify the cervix type. The images taken with the EVA system and the experts who help us to classify them allow us to collect a large dataset. And with your help, we could make the classification automatic, providing every woman with the best care, no matter where she is. We thank you for listening and wish you good luck in the competition. The MobileODT team.